Lichen planus is an inflammatory condition that affects your skin, hair, nails, and mucous membranes. It usually appears as a purple flat rash on the skin that is often extremely itchy. The condition can also affect the inside of the mouth, appearing as white, lace-like patches, or painful sores. In some cases, lichen planus affects the scalp, leading to hair loss, or the nails, causing ridges and thinning. The name might sound a bit strange, but it comes from the fact that the rash can look similar to lichens growing on rocks. It is an autoimmune disorder, which means your immune system mistakenly attacks your own body. In this case, it targets your skin and mucous membranes, causing inflammation and irritation. Think of it as your body's defense system getting confused and attacking perfectly healthy cells, causing inflammation and those characteristic purple, itchy bumps. It's important to note here that it's not caused by an infection, and it's not something you can catch from someone else. While it can be uncomfortable and sometimes frustrating to deal with, it's not contagious, and in many cases, it will go away on its own after a year or two. Types of lichen planus. There are several different types of lichen planus, each affecting different parts of the body and showing up in different ways. Here are the main types. Number 1. Cutaneous lichen planus. Cutaneous lichen planus affects the skin and is the most common type. It typically appears as purple, flat-topped bumps that can be extremely itchy. These bumps often have a shiny surface and might show white lines called lichens stria. Number 2. Oral lichen planus. This type affects the inside of your mouth. It can appear as white, lacy patches on the inside of your cheeks, or as painful sores and ulcers. Some people might not even notice they have it if it's mild, while others might find it makes eating and drinking uncomfortable. Number 3. Genital lichen planus. Genital lichen planus affects the genital area and can be particularly uncomfortable. It can cause scarring and might need long-term management to prevent complications. Number 4. Nail lichen planus. This type affects the fingernails and toenails, causing them to become thin, ridged, or even separate from the nail bed. In some cases, permanent nail damage can occur. Number 5. Scalp lichen planus. This type affects the scalp and can cause hair loss. If not treated early, the hair loss can become permanent in the affected areas. Symptoms of lichen planus. The symptoms of lichen planus can vary depending on which type you have and where it appears on your body. Let's walk through how it typically feels and looks in different areas. On the skin, the classic signs are purple, flat-topped bumps that are incredibly itchy. These bumps often appear on the wrists, lower back, and ankles first. They might look shiny when you look at them under bright light. The itching can be intense and might get worse at night. In your mouth, you might notice white, lacy patterns on the inside of your cheeks. Sometimes these patterns might not cause any discomfort, but in other cases, you might develop painful sores or ulcers. Your gums might become red and sore, and eating spicy or acidic foods can be uncomfortable. When it affects the nails, you might notice ridges forming in your fingernails or toenails. The nails might become thin and brittle, and in some cases, they might even separate from the nail bed. Some people lose their nails completely, though this is rare. When the condition affects the scalp, it can cause intense itching, redness, and scaling. You might notice small patches of hair loss that can become permanent if the condition isn't treated promptly. In the genital area, it can cause intense itching and burning. The skin might become thickened and white patches might develop. This can be particularly distressing and might affect intimate relationships. Causes of lichen planus. The exact cause of lichen planus isn't fully understood, but several factors seem to play a role. As mentioned earlier, it's an autoimmune condition where your immune system attacks your own cells. However, certain triggers can set this process in motion. Viral infections, particularly hepatitis C, have been linked to the development of lichen planus. Studies suggest that people with hepatitis C are at a higher risk of developing oral and cutaneous forms of the disease. Stress also appears to be a significant trigger for many people. During stressful periods, the condition often flares up or gets worse. The relationship between stress and autoimmune conditions is complex, but we know that stress can affect how your immune system functions. Certain medications have also been known to trigger lichen planus in some individuals. These include some medications for high blood pressure, heart disease, and arthritis. When a condition is caused by medication, it is referred to as drug-induced lichen planus and typically resolves once the medication is discontinued. Allergic reactions to dental materials, such as mercury in dental fillings, have also been suggested as a possible trigger for oral lichen planus. Since lichen planus is an immune-related disease, conditions that affect immune system function, such as autoimmune disorders, may increase the likelihood of developing it. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of lichen planus. Diagnosing lichen planus typically involves several steps. Your doctor will start with a detailed medical history and physical examination. They'll want to know when your symptoms started, what makes them better or worse, and whether you're taking any medications that might be triggering the condition. A skin biopsy is often necessary to confirm the diagnosis. This involves taking a small sample of affected skin and examining it under a microscope. The distinctive pattern of inflammation seen in lichen planus helps confirm the diagnosis. For oral lichen planus, a biopsy of the mouth tissue might be needed. This is particularly important because some cases of oral lichen planus can increase the risk of oral cancer, so regular monitoring is important. Blood tests might also be ordered to check for underlying conditions, particularly hepatitis C, which has been linked to lichen planus. Your doctor might also want to check your overall health status and rule out other conditions that could be causing similar symptoms. Treatment for lichen planus. One of the most important things to know about lichen planus is that it often resolves on its own within 1 to 2 years, even without treatment. However, this varies from person to person. Some cases might clear up in a few months, while others might take longer than 2 years. During this period, there are several treatments available to help manage the symptoms until the condition goes away on its own. Number 1. Topical corticosteroids. These are usually the first-line treatment for lichen planus. Corticosteroid creams or ointments help reduce inflammation and relieve itching. For oral lichen planus, corticosteroid mouthwashes or gels can be used. The strength of the steroid prescribed will depend on the severity of your symptoms. These medications need to be used carefully and as directed, as long-term use can cause side effects like skin thinning. Number 2. Oral medications. For severe cases, or when topical treatments aren't effective enough, oral medications might be prescribed. These can include oral corticosteroids for short-term use in severe flares, or other medications that suppress the immune system response. Medications like acitretin or immunosuppressants might be used for stubborn cases. These medications require careful monitoring due to potential side effects. Number 3. Light therapy. This treatment involves exposing the skin to controlled amounts of ultraviolet light. It's like getting a very specific type of light exposure that can help calm down the immune response in your skin. Phototherapy, particularly PUVA or narrowband UVB therapy, can be effective for widespread skin involvement. Number 4. Immunosuppressive medications. If lichen planus does not respond to standard treatments, immunosuppressive drugs such as methotrexate, cyclosporin, or hydroxychloroquine may be used to suppress the overactive immune response. These medications are typically reserved for severe or resistant cases, as they require close monitoring for potential side effects, including liver and kidney complications. Number 5. Retinoids. Retinoids are derived from vitamin A and can be used topically or orally to treat lichen planus. They help reduce inflammation and promote healing of the skin or mucous membranes. Oral retinoids, such as acitretin, are usually reserved for severe cases because they can have significant side effects, including dry skin and liver problems. At the end, remember, for skin lichen planus, about 50% of cases clear up within 6 months to a year, and up to 85% of cases resolve within 18 to 24 months. However, oral lichen planus tends to be more persistent and may last longer or recur over time, which is why ongoing monitoring is important even after symptoms improve. Some people might experience occasional flare-ups even after the condition has mostly resolved. These can often be managed with the treatments mentioned earlier, and they typically become less frequent over time. Now we want to hear from you. Have you or someone you know ever experienced lichen planus? What symptoms were the most challenging, and how did you manage them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.